Hey everybody, Professor H here again. In this short video, we're going to talk a little bit about stress and illness. So this will be our third short little lecture video. When we feel stressed, we have three main types of consequences of that stress. The first one are direct physiological consequences. In other words, stuff that goes on with your body, your physical well-being. We might exhibit harmful behaviors, and we have indirect health-related behaviors. So let's go over those real quick. The first one, direct physiological effects: elevated blood pressure, decrease in the immune system functioning, increased hormonal activity, psychophysiological conditions. So for example, if I'm really stressed out, I got deadlines to meet, I'm having difficulty meeting those deadlines, I am going to develop a lot of muscle tension up in my neck and my shoulders. Before long, my hand might be going numb. My hand, whoa, I can't make that work. My hand is going numb, or I am having a headache because the muscle tightness and all of that can lead to aches and pains, muscle problems, indigestion, all kinds of things. Harmful behaviors are things that we do sometimes to mitigate the stress. So we might have increased smoking. Smoking is something that, even though it's technically a stimulant with tobacco smoking, it will also calm people. So it has very interesting effects. Alcohol is something people often use to take the edge off. You might stop eating, or you might actually increase your eating. Most of the time, if you're stressed, you have decreased sleep because you find it hard to fall asleep and find it hard to stay asleep. And if you're using any of these substances, that's going to make it even worse, because even though maybe having a couple drinks before bed might knock you out and you are going to go to sleep, you are not going to have good quality sleep that takes you through all the stages and is refreshing to your body. Increased drug use. Obviously, a lot of times people with stress increase things like all sorts of different drugs. Indirect health-related behaviors: decreased compliance with medical advice, increased delay in seeking medical advice, and decreases in likelihood to. Just to follow up on the previous slide, I did the same one over because I started coughing and was kind of melting down because I couldn't read the last words on the slide here. So the indirect health-related behaviors are: if you're really stressed, say you can't miss work, you can't take time off to go to the doctors, even though technically you legally have that time off, you know you can't do it because then your workload's going to pile up. So you don't go to the doctor. You don't take care of something that's just a little thing that's been bothering you. And the next thing you know, it turns into a big thing because your body is not functioning properly due to the stress and you're not seeking appropriate medical advice. So the decreased compliance means that, you're supposed to go to physical therapy 3 times a week because you've got, okay, for me, example, I have spinal stenosis in my neck, which means that the opening of the foramen where the nerve passes through is becoming smaller. So if I'm tense and I have inflammation from my muscles being clenched, my arm's going to go numb, right? So they send me physical therapy. I'm supposed to go to physical therapy 2 or 3 times a week. Well, if I'm privileged and in a situation where I could go, and I told them I can go once a week, so I was able to at least go once a week, but some people won't be able to take that time off their job. So even though they're supposed to go to physical therapy 3 times a week, they can't. They just get the sheet from the first appointment they go to, and then they go with that, which is definitely not ideal. But that's a decreased compliance in medical advice. An increase in delay of carrying out your medical advice. Sometimes you're like, oh, yeah, I need to get, they told me to get this antacid and this whatever, but I haven't been able to shop for it. And money's tight, so I'm going to set that aside now, and I'll come back to it when it's really bothering me. Finances have a lot to do with how much stress you have. The higher the income you have, the lower the stress. The data shows that those in the lower income levels are having higher stress. And with that, they have reduced access to healthcare because co-pays or having to pay directly for your medical care when you don't have any money and you don't have a good insurance policy are very detrimental to people's health. So these are some of the harmful things that we see with stress that are related to our indirect health-related behaviors. So what I was talking about earlier with all that tension in my neck and getting a headache and having worse aches and pains, maybe my back is hurting, those things go along with psychophysiological disorders. So these are things that are the physical effects of our psychological stress. Chronic stress and its sustained physiological reactions can lead to wear and tear on the body. It's really hard on us when we feel stressed like that. Sustained high blood pressure can lead to heart attack or heart failure. Continuous exposure to cortisol can weaken the immune system, putting the person at risk for infection and disease. Remember that autonomic nervous system, we have our parasympathetic and our sympathetic nervous system, and the sympathetic nervous system is triggered when we are perceiving something as a threat, when we feel like we are under stress. What happens is that is turned on. We're increasing our epinephrine and so that's our adrenaline, basically our adrenaline, and we're going to also increase a lot of hormones, including cortisol, which in the short term is beneficial, but in the long term can be very harmful because it decreases the effectiveness of our immune system. So let's see, things that are caused here by these physiological or psychophysiological responses to stress are tension, headaches, asthma, acne, eczema, hypertension, which is high blood pressure, irritable bowel syndrome, and coronary artery disease. So basically, what this is saying is not that just stress alone is going to cause these, because the tension headaches are something that can be caused by stress alone. For these other disorders, there has to be some other underlying factors. For example, I have asthma. I've had asthma since I was a small child. I didn't have asthma just because I became tense. I have asthma because that's just physiologically one of my little defects, right? But I have learned how to do relaxation exercises to help reduce my asthma symptoms. I have had to learn that when you are on when your emotional state is great, strong emotions of any kind can trigger an asthma attack. For me, the first time I watched Despicable Me, I laughed so hard that I actually had an asthma attack because I thought it was great. I was laughing so hard. So it's not only negative things for my asthma, also, exercise, which is a physiological stress, which triggers my asthma also. Same thing with acne, eczema, hypertension, high blood pressure. If you're in a lot of pain or a lot of stress, your blood pressure may rise. Irritable bowel syndrome and coronary artery disease. The reason why this happens, this coronary heart disease, is because when you are under a lot of stress, what happens over time is your cholesterol increases and your body is laying down more cholesterol inside those blood vessels. So it could cause some serious damage there. I know I continually say it over and over again that stress has a negative impact on the immune system. And just a little sneak peek of how to deal with this is exercise. If you can walk for 20 minutes, it helps kind of smooth out these hormones, and it can really increase your functioning, raises the positive neurotransmitters like dopamine and serotonin, and can help dissipate some of the cortisol and things like that have been building up. So you're using it instead of having it just sit in your body. So that's just a sneak peek of something you can do. All right, so immune system errors are something that is likely to occur with long-term stress. Autoimmune disease, those are immune system mistakes. When the mistakes the body's own healthy cells for invaders and repeatedly attacks them. There are many different types of autoimmune diseases out there, like lupus is one of those diseases. There are several out there where when you become stressed, your own immune system starts attacking healthy cells, and it mistakes the healthy cells for invaders like bacteria or something. Immunosuppression is the decreased effectiveness of the immune system. And that's the most common thing you see. Is like when somebody's under long-term stress, they have immunosuppression. In other words, their body stops making as many white blood cells to go fight infection, and you are more likely to get sick. Okay, so psychoneuroimmunology is a field that studies how psychological factors influence the immune system and immune functioning. And I've mentioned this before as well. Studies have shown that the immune system can be classically conditioned, leading to the idea that if classically conditioning can alter immunity, then so can other psychological factors. So an example of this is like, oh my gosh, every time I hear like my dad going down the hall, I can like hear his door open, hear the cane going. I'm like, oh my gosh, he doesn't have his walker. He's going to trip over the dog. So like the minute I hear that, I all of a sudden go into that fight or flight mode. So I'm like classically conditioned for this to occur. It's just something that happens automatically. How does stress weaken the immune system? Well, through all of these hormones that are being released through that kind of extended fight or flight mode going on, you have the production of lymphocyte. You have an inhibited production of lymphocytes. In other words, as I mentioned previously, you have fewer white blood cells to go gobble up the bad stuff in your bloodstream. So that is the main way that we think that the immune system is being negatively impacted by stress. An interesting study that demonstrates the impact of stress on immune function is this one done by Cohen in 1998. In this particular study, 276 volunteers were interviewed about their stressful experiences. So they were given questionnaires to determine how much stress they had been experiencing in a 1-month period, 3-month period, and a 6-month period. And after the interview and the data was collected, they were given nasal drops containing a cold virus. And what the graph here shows is that those that were experiencing chronic stress had more response to the cold. In other words, a higher percentage of those who were experiencing the stress got the cold after being given the virus. So if we look at the data for 1 month, we're seeing that about 35% got the cold that were not feeling chronic stress, whereas almost 50% of those with chronic stress for a 1-month period went ahead and got a cold after exposure to the virus. Because you could be exposed to a virus and not get sick. It just depends on how much of the virus you are exposed to and what your immune function is at the time. For those that were reporting 3 months of chronic stress, there was a very significant difference between those who didn't experience the chronic stress for 3 months and those who did experience the chronic stress for at least 3-month period. For the 3-month group, we have, around 35% again that got sick for the non-stress group, and we had over 50% in the group that was reporting chronic stress. And the data is very similar for those that were reporting chronic stress over 6 months. So basically, one of the things that they're saying is that if you have chronic stress that goes over 1 month, you are more likely to get sick because your immune system will be suppressed by the stress. So do your best to think about those uplifts and things that you can do to reduce your amount of chronic stress you're experiencing. Easier said than done, but it is possible. Here's some other interesting findings of research. And let's see, your book has the reference for this research. This is Blackburn and Epel 2012. So you can look up that reference in your book. Basically, what they're talking about here is that when you are under chronic stress for a period of time, you end up aging a lot faster. And if you've ever seen somebody who's in a really stressful period of their life, they look like they've aged like several years when they're going through a lot of stress. And that's because actually on a cellular level, they have aged quite a bit. There's a little thing called telomeres, and it's a segment of the DNA that protects the end of the chromosomes. So it is an important little thing on the end of the chromosomes, and over time they get shorter as you age. But what they found in this particular study is that the telomeres on the DNA became much shorter in adults who experienced more trauma as children. So we've learned in recent times that adverse childhood experiences really impact the way that we manage stress. When we're growing up and we have like severe traumas, it has a lasting impact on our nervous system. And so this particular study is showing that in adults who were experiencing stress, they had shorter telomeres. And the ones who experienced childhood trauma and then were going through stress, this group had more shortened telomeres. So in other words, it's basically aging your whole system when you're exposed to chronic stress, and you're extremely vulnerable to this when you have had a lot of childhood traumas. And if you take abnormal psychology, you'll see that adverse childhood experiences really can make you more vulnerable to a lot of different disorders and things like that. So if you've had those types of experience, it's really good to get some therapy or counseling about it and work on ways to mitigate how that impacts you. Another way that stress impacts our physical health and well-being is impacted by our personality type. So our personality type will actually have an impact on how much stress we feel and how that stress impacts our physical health. Friedman and Roseman in 1974 discovered that people who are prone to heart disease tend to think, feel, and act differently than those who are not. They found that heart disease is over 7 times more frequent among type A personalities. So a type A personality is someone who is pretty intense, competitive, impatient, and oftentimes is quick to be hostile with others. So this is somebody who's got a short fuse, or maybe they'll hear something and they'll just kind of immediate response is to be angry and uptight over it, and even before they maybe know all the details of the situation. They just have a tendency to be intense about all of this. That personality type is positively correlated with increased incidence of heart disease and heart attack and things like that. So type B personality are kind of laid back and relaxed. These are the folks that kind of take it with a grain of salt, think about it, and it's kind of hard to get them stirred up and upset. Further research suggests that one of the most important factors in the development of heart disease is anger and hostility. So the particular personality trait within this type A personality is anger and hostility. That is the one that is most strongly correlated with developing heart disease. Individuals that indicated they responded to pressure with anger were over 6 times more likely than those who indicated less anger to have a heart attack by the age of 55. So this particular personality type puts you at risk. When you start getting angry and uptight, your blood pressure goes up. When your blood pressure goes up, your heart is working harder and putting more pressure on that entire system. There's a lot of other factors involved too, like increased cholesterol and things like that can occur. So your personality type is something that will impact how you deal with stress and how that stress impacts your health. Stress and cardiovascular disease go hand in hand. Cardiovascular effects of stress, basically your everyday stress, when you're under stress, it changes how the cholesterol is processed in your body. And basically, it increases the amount of cholesterol deposits that are laid down like in your vessels and veins and stuff. Type A personality, once again, is really highly correlated with cardiovascular disease. And remember, correlation is not causation. It's just one factor that is related to coronary artery disease. So chronic stress response leading to increased blood pressure, higher levels of stress hormones, and of course, type A personality tends to run in families. So oftentimes there are genetic components of your personality, and there are also environmental factors as well. So maybe your family, this is just kind of how they deal with stuff. They fly off the handle and then come around and maybe chill out afterward. How you learn to deal with stress and how you respond to certain situations are things that you learn from a child in the environment that you're in. So the environmental portion plus the innate factors, those biological genetic components of your personality work together to create that type A behavior. Here we take a look at the relationship of stress to arteriosclerosis. This is when you have what's called hardening of the arteries. It's where you basically, you start off with a normal artery, and then as time goes on, you start to have a little bit of what you call plaques being laid down, the cholesterol plaques that are clinging to the side of the vessel. When you have significant arteriosclerosis, you have the vessel is greatly occluded. So basically, your vessel is blocked almost all the way. And then the last stage is when you have complete blockages due to the cholesterol. And oftentimes, this can be anywhere. These can be the big vessels and things going to your heart. It can be anywhere in your body. But when you increase the stress, you have more cholesterol being laid down on the inside of your veins. Your diet matters a lot, because if you're eating high cholesterol foods, that of course is going to predispose you to have the high cholesterol, that cholesterol being laid down. But then you add stress to it and it changes the way your body reacts, and you end up laying down more of this cholesterol in your arteries than you would normally. Moving on now to asthma. Asthma is very related to stress, because stress can make your asthma symptoms a lot worse. I've had asthma since I was about 4 years old. I used to have to go to the office during school and go take asthma medication every single day. They didn't have all the good medications when I was a kid that they have now. I had to learn relaxation techniques and other ways to manage my asthma other than just the medications that we have today. And I spent like half my childhood in the ER. So I really didn't like the way that our book portrayed asthma with stress, because it made it look like people are just like, oh, they're just whiny, emotional people, and that makes them have an asthma attack. And that's not what the case is. Asthma is a chronic disease in which the airways become inflamed and narrowed, leading to difficulty breathing. Psychological factors play an important role in asthma. That is true, because when you become emotional, it does increase your chances of having an asthma attack. Studies show that some people with asthma will experience asthma-like symptoms if they expect to experience asthma-like symptoms. So basically, what I would take from this, and I do not have the data right here in front of me on this, so I'm interested to find out more about it. But what they're saying is that if you're anticipating it, it means you're having some anxiety over it. That anxiety is what can induce the asthma attack. People with asthma report and display a high level of negative emotions, in other words, anxiety. Sometimes when you have a chronic disease of some sort and you're concerned about being in situations that could trigger your chronic disease to be worse, it can lead to anxiety. Anxiety can lead to an asthma attack. That increase in the nervous system. Also, in some people, exercise can induce asthma. I personally also have exercise-induced asthma. So if I got into, if I was running track when I was young, I had to stop because I would have asthma attacks. So I couldn't do that. When I was around moldy hay or somebody just cut the grass, my allergies would trigger an asthma attack. Asthma attacks have been linked to periods of high emotionality, like, for example, but it's not all negative. Like, the first time I watched Despicable Me, I thought that thing was so funny. I laughed so hard that I actually had an asthma attack. And then exposure to stressful experiences has been linked to the development of asthma throughout the lifespan. I would need to read those papers and see the data on this. But it is definitely true that like adverse childhood experiences and stress during childhood does change the functioning of your nervous system and could decrease your ability to fight off disease. We'll take another look at asthma on the next slide. This illustration can give you a little bit of an idea of what people with asthma go through as far as the breathing. And asthma can kill you. So it's really important that people who have asthma have a rescue inhaler on hand, know where the nearest hospital is, and things like that, because it really can be quite life-threatening. So this is a little close-up of one of your little tubes inside of your lungs, your alveoli, I believe, or this might be a airway. So this is the airway wall where the little air comes in here, goes in and out. And so what happens here is that in a normal lung, this tissue will be just, a normal muscle wall, and the airway will be open and the air can easily flow in and out. But what happens when somebody has an asthma attack and can also kind of cause some more trouble over time is that the walls, some of the muscles of the airway constrict. So this is all muscle tissue it's showing on the outside. These stripy things are the muscle tissues. And then over here, you can see that when those muscles constrict, it's closing up the airway and limiting the airflow and mucus. And you start having mucus inside the airway also. So we have a thickened airway wall and mucus because of the muscle contractions. So you have to be able to release those muscles, have them all relax and open up. So like, giving a albuterol inhaler or epinephrine, which is adrenaline, those types of things are going to open up those airways and help to clear those airways so that mucus can come out, that can be coughed out or whatever, and reabsorbed, and the airway can open up for people to breathe. So anyway, a lot of people, if they're new to experiencing it, it's a very panicky feeling because it feels like you're drowning, like you just can't get any air. So it's kind of a terrible thing, but it doesn't really faze me at this point because I've had it since I was 4 years old, and my asthma has gotten better with time. That may be an overshare, but I just wanted to give you an idea of how this condition works in relation to stress. Stress can trigger this condition to get worse. Another condition I wanted to mention that is problematic with long-term stress is arthritis, because rheumatoid arthritis, has a lot of inflammation and such in the joints, and it causes all kinds of issue with all of your joints. And when you are having that long-term stress and those high amounts of cortisol, basically, instead of the cortisol having the anti-inflammatory effect that you need short-term, what happens is long-term, it is keeping your body from being able to reduce the inflammation that you're experiencing. And it can really worsen conditions like rheumatoid arthritis. Burnout is another interesting result of stress. Burnout is physical and psychological exhaustion associated with chronic exposure to stress. Burnout is a form of exhaustion caused by constantly feeling swamped. It happens when we experience too much emotional, physical, and mental fatigue for too long. It can be chronic and lead to depression and even suicidal ideation in extreme cases. Stress can make you feel overwhelmed, but burnout makes you feel like you're depleted and used up. So burnout is kind of a step beyond just feeling super stressed out. And a lot of times it's associated with job stress. It's probably one of the highest things associated with burnout. But it can also be if you're a caregiver or other situations can cause burnout. So this is just another condition that impacts our health and is related to stress and immune function. Well, that's it for this particular slide. The next one will be a little video about coping with stress. I know I got a little rushed at the end of this one. I'm just trying to get these up and posted for you guys before the end of our class. So if you have any questions, as usual, if you're in my class, go ahead and shoot me an email or message me, and I will get back to you as soon as I can. Thanks a lot.